Okay, well, good afternoon, everyone. Welcome to Greening the Healthcare Sector, one of 30 events as part of this week's Australian Circular Economy Conference. The conference is co-hosted by the Waste Transformation Research Hub, the Sydney Knowledge Hub, New South Wales Circular, and the Association of Pacific Rim Universities. I'm Rupal Isman, the director of the Sydney Knowledge Hub here at the University of Sydney on Gadigal land. I'd like to acknowledge their custodianship of this beautiful part of Sydney on this wonderful day. This always was and always will be Aboriginal land. This conference goes until Friday, and after I stop talking, I'll post an event or two that you may be keen to attend, as well as a link to the full program. I am really looking forward to this conversation. Up next, for a person who's trying to minimize my footprint, the healthcare sector seems almost off limits as a discussion point of reducing waste. So I'm pleased to introduce the passionate Anna Noonan, Business Development Manager, Regional New South Wales and Rural Health, who is going to lead this conversation on greening the healthcare sector. Anna?
Thank you so much, Rupal, and welcome everyone this afternoon. Welcome to Greening the Healthcare System, our virtual panel, and thank you to our panelists for being here today. It's really exciting. It's actually spawned from a simple conversation that we had in the corridor one day, but surely there is a better way to manage the enormous volume of waste that is coming out of our Australian healthcare system, and particularly during COVID, as the surge of the use of sterile wrap and PPE has happened. And I'm pleased to have some excellent speakers with you this afternoon. I will be your MC or chair if you like. And as I begin, I'm conscious that we are all coming in from very different places and would like to acknowledge that today I'm beaming in from beautiful Wiradjuri country, land never ceded. I live and work in Orange, and acknowledge all of the First Nations of this country and the ancient knowledges that are stored within the lands we are privileged to live on, and particularly the knowledge that human health and environmental health go hand in hand. And I think that's something that we have probably lost a little bit over the past 200 and something years of colonisation, and I'm looking forward to finding a pathway back to that holistic understanding of what it means to be healthy, both ourselves and our planet. I'm going to stop sharing now. The way that we're going to run this event is we have 4 fantastic speakers who I'm about to introduce. We will have 2 of our speakers first who will take us into the health service and into the space in which the waste is happening, if you like. And then we will have a brief pause to show a short video about some successful initiatives that have happened most recently. And then we will be talking to 2 partners from industry and also from local government about what possibilities they are in terms of waste management for the future. So please do pop any questions that you may have in the Q&A or indeed in the chat. And if you would like to say hello and tell us what country you're beaming in from as well, please feel free to do that too. We would ask though that you stay on mute just so that we can have a clear voice of our speakers. So you will see our speakers up on your screen hopefully here, and I would like to now introduce our first speaker, Forbes McGain, who is an intensive care clinician at Western Health in Victoria, who has been one of the, I hope don't mind me saying, Forbes, one of the champions of greening the healthcare system, and I'm looking forward to hearing Forbes sharing his story. Over to you, Forbes.
Sorry, but I think you can hear me. I'm just making sure. Can you see my screen yet? Yes, great. Okay. Thanks for a brief moment there. So I work in anaesthetics and intensive care at Western Health. I also have links with the Doctors for the Environment and the Climate and Health Alliance, as well as University of Sydney, University of Melbourne. So in, well, a bit under 10 minutes, we're going to race through my little story. I think that I'd just begin here, given that we're in New South Wales, or at least most of you are, and we can recognise the unpleasant sight of fires burning at the end of end of last year, and how dry our arid land is. Look at that redness over the Darling and those little streaks of rivers. We didn't miss out in Victoria of this problem either. Malakuta, a child, mum and a dog, all looking pretty worried about the ominous colour of the sky there as the fires rain down upon them. Climate change is here. I wanted to show you then, in a way we talk about waste, there's physical waste, there's also climate waste. here we are, we've got a map of Tasmania and the south of Victoria. At Cape Grim, that's where we measure a lot of the CO2 and the methane and all the other sorts of gases that are flying around in the atmosphere. And this is courtesy of my good friends at Atmospheric Science, CSIRO. They get a lot of westerlies belting through all the way from South America. So very clean air that comes and hits the west coast of Tasmania. But every 10 days or so, they get the northerlies blowing down from Melbourne. And I'll show you how Tasmania smells Melbourne, as it were, with their testing. What this busy slide shows, just focus there on the red one, which shows the carbon dioxide levels. What you can see is that there's a background level of about 400 parts per million, which spikes up when the northerlies come through from Melbourne. So in other words, the stink of Melbourne hits northern Tasmania every 10 days or so when the northerlies come screaming through. And what's fascinating is that we can even see our anaesthetic gases coming through. So they can measure down to parts per trillion anaesthetic gases coming through. You can see there's a background level flying around in the atmosphere coming through from South America. But in addition to that, they get a stench of Melbourne coming through every 10 days. So we can smell anaesthetic gases. It's quite extraordinary the degree, I suppose, of contamination and pollution of this planet that we undertake on a daily basis. What I will say is, why does this matter? Is that desflurane, a bit like nitrous oxide, they're quite highly polluting, high global warming gases. If you use a small bottle of one of those, you're using several days worth of another gas, which is fine, and you can use it, sevoflurane. It's just as effective. It's nowhere near as polluting, as we'd say. And so using that desflurane for 1 hour, just 1 hour of anaesthesia, is like burning 30 litres of petrol. So I wanted to give you an idea that this matters. The environmental effects of one doctor, sorry, apologies to my wife, is that work matters more than home. It really does. What you do at work, and RuPaul was alluding to that, is that healthcare has a massive carbon footprint. How big? Well, with my friends at the University of Sydney and with Scott in Melbourne, we looked at the healthcare's carbon emissions. It's around about 7% of the total emissions of Australia. So that's about the same as South Australia. In other words, every flight, every car travel, every bit of food that every South Australian eats, every bit of electricity, anything they do that has an energy footprint associated with it, it's about the same as you imagine their healthcare would be. So it's big. And I would say is that there's some good news happening in other parts, and I give you of the economy. For example, I could look at Monash, Melbourne, and I'm just choosing Monash. There are a number of other universities that are doing there. I think the university sector is leading the way with a change to a low carbon world, getting off gas, with apologies to the federal government, and moving to a land of low carbon. I would say that within healthcare, we've got a long way to go. I think there's some really good work happening at the levels of the Australian Medical Association, the Australian Nurses and Midwifery Foundation, medical and nursing colleges, Climate and Health Alliance, and the Doctors for the Environment. I put those two in bold because I'm members, Healthy Futures, and some other groups. I will now just very briefly show you a little bit about what we call life cycle assessment. In other words, it's looking at when you want to look at a product and compare a disposable to a reusable product, for example, you've got to look at many parts of the story of its production, of its movement, of its waste, whether it's recycled or reused. And to give you just one example of a number of different anaesthetic equipment we looked at, we looked at having a disposable versus reusable equipment. And here's some examples of things we use. You can see the face masks, the circuits, the metal blades that you use when you're putting tubes in people's throats. And we compared them with a disposable and a reusable variant. At the Austin Hospital in Melbourne, they use disposable. At Western Health, where I work, we use reusable. One of the members of the office committee said, well, you should work out, well, is it less or more expensive to have disposable or reusable? And does it have a lower carbon footprint? Well, what we did is you can see we measured back of house, as it's called, in Central Sterile Supply Department, and we measured not only what the time it took to wash things, in other words, labour costs, but also the energy footprint. Here's the back of a steriliser wrapped up in silver to keep it warm, and we measured for a year all the electricity being used and the water being used, for example, through Wi-Fi. And what we come out with after measuring those and comparing single-use and disposable is an interesting story. Just as a little aside, when you're burning electricity, for example, Victoria, unfortunately, is one of the worst places in the world to be doing that because we're based on brown coal. That is starting to shift, but we've got a long way to go. And what I'm saying is that the relative amount here of Victoria producing about 1 kilogram of CO2 compared to New Zealand, which is 1.15. In other words, it's saying that 10 New Zealanders is basically the same as 1 Victorian running their electricity. It really does matter. Having renewables makes a big difference in your carbon footprint. And it's not just the lights, it actually relates to all sorts of things, such as when you're using reusable equipment, because you're running the sterilizer, for example, on electricity that's either renewable or not. What I want to show you here is the numbers don't matter too much, it's just that if we use reusable things, you can see the red one here, versus the yellow, which is disposable, surprisingly, there wasn't that much difference. We were surprised, but it shows you that when you're based on brown coal, you've got a problem. However, you're using reusable anaesthetic equipment in Europe, you can see the green here is much, much lower. Europe has an entirely different electricity source, a lot of renewables, nuclear as well. Even in the USA, where you can see the blue is still about half the red. In other words, there's a lot more renewables. Yes, there is some nuclear as well, but it's a very different energy mix to Australia. Australia and China are very similar, and that's a big problem. It means that if you're going to try and show from an environmental perspective, then you need to shift your energy source. You need to make sterilizer more efficient as well. And that's another story I'd love to explain another day for those who are interested. What does this mean? What we did show, though, was that there was a financial benefit of using reusable equipment. I think that was a really important part. And because we have it also shows that the reach of coal is very deep. It's not just about your electricity for your lights, the electricity for the sterilizers, electricity for all your reusable equipment, and that we need to go reusable very soon. I then want to show you very quickly, because in the interest of time, just a bit of recycling. When I came to Western Health 13 years ago, people said there wasn't that much to recycle, so we just left 2 days of the wrap here, and everyone said, oh, we actually do have a lot of waste, don't we? So the good thing was that was all ending up in, originally that was all in landfill, now we're able to turn it into recycled equipment. And you can also see the other exciting thing we've been doing for around 10 years now with Sophie McMillan and others from the Vinyl Council of Australia, Baxter and other groups, is looking at PVC recycling. And that's another really exciting project that now has expanded out to over 100 hospitals in Australia, New Zealand and beyond. And you can see made in Melbourne, that was your intravenous fluid bags and your oxygen face masks, for example. That's now agricultural pipe. What happens to the other green wrap you saw? Well, it ends up, as you can see, as bollards and planks and other such things in places where you and I would probably rather be on a brilliant day like today. So that's really important. Another really exciting project to be involved with that recycling process. What are our next steps? Well, there we are. That was more than 50 years ago now, man landing on the moon. And yet 50 years later, I just find it extraordinary. We're still using single-use metalware, actually using more and more stuff. We're going the wrong way. 50 years after Apollo 11, we're miles away from environmental sustainability. We use more and more single-use equipment. Medicine seems to be the least circular part of our economy. And our response to COVID-19 is just use more PPE. Where is the balance and balancing the needs of the patient and the healthcare worker and the environment? I mentioned in the interest of time, climate crisis is a health crisis. Health itself pollutes. We can and must move to the land of low carbon. I reach out to Muriel Chamberlain and the Full Circle Fibres. I say that now as they're doing some interesting work in Brisbane looking at reusable gowns, for example, instead of using disposable PPE. And certainly reach out to the Doctors for the Environment and the Climate and Health Alliance. And I would say that decisions made now matter. Decisions made in 2050 are irrelevant. We need to move now. Thanks for your time.
Thank you, Forbes, for what is a whirlwind tour of the reality of what we're facing in Australia. And it's, it's one of the great ironies, I think, to think that the system that is protecting our community and keeping us healthy is also a system that itself is contributing to the pollution. And of course, and it's no fault of any particular person or clinician here, but a collective approach that really aims to diminish the output or think through the reuse, recycle, reprocess, I think is as an exciting one. It's great to see clinicians like yourself undertaking this work. I imagine it's no easy feat, however, to negotiate these changes within the health system. And so if you do have any questions for Forbes, you're welcome to pop them in the Q&A and Forbes can answer them there, or you can pop them in the chat so that all panelists can see. Thank you very much, Forbes. It was remiss of me to mention that this event is a partnership actually between the Western New South Wales Local Health District and Orange City Council and the University of Sydney. So we're of course also conscious that in the rural health sector there's also the elevated amount of aircraft in the air, cars on the road, and the complex logistics of moving health materials across enormous geographic distances. And I would love to now invite Lacey Healy, who is here as Acting General Manager of Orange Health Service, to now speak a little bit about what Orange Health Service is doing as a leading hospital in a rural local health district in this space.
Thank you. I'll just navigate my screen here. And thank you, Forbes. I found that really an energizing presentation, and it seems that you're doing some really great work leading at your hospital. What I wanted to focus on today was to share with you some of the successes we've had with recycling at Orange Hospital, and then at the very end spend 2 minutes putting out there some of the problem areas. Maybe some of the collective intellect could reach out if they had any suggestions for what Orange Hospital might be able to do. So as you move through the hospital, much like any other health facility, it can be quite overwhelming to look at the amount of waste that is a byproduct of our services. So starting with toner cartridges, which is a very basic thing, not unique to healthcare, but as you can see here, there's about 460 kilos so far this year generated just by the printers in our facility. We do cardboard recycling really well at Orange Hospital. Every ward throughout the facility has a recycling bin. We've also got a chance bin, which we place on the back dock and try and promote that any additional boxes that delivery people arrive with use those bins for recycling. Our compactor crushes about 4.5 tonnes every 5 weeks. Here, not unique to Orange Hospital, I'm sure, but a unique partnership with a local organisation, Wangarang Industries. We reached out to Wangarang to help us recycle all the water bottles, cans and juice bottles within the facility. So these bins can be spotted throughout the facility. They're in patient areas, and the proceeds of the recycling, we share 50-50 with Wangarang, which they're an employment provider that offer opportunities to people who have disabilities in Orange. Here's a unique one, the timber pallet recycling. So we've partnered with our local men's shed and they collect their timber pallets and then repurpose them. And I thought this was a very festive example of some of the things that they do. PVC recycling, so these bins are placed in theatres to capture the masks for recycling. So we've set up these recycling stations that are also making sure that people don't place the metal clips or the non-recyclable items in, and this has been a real hit and really well received in this clinical space. More recycling stations, so this is appropriate recycling of the PVC. So the bin is beside the sink. You can just see here the staff just use the scissors to snip off the non-recyclable and dispose of the recyclable materials appropriately. So it's setting up opportunities so staff don't have to think too hard about how they recycle and making it a convenient move. The aluminium recycling, so these bins collect the aluminium anaesthetic bottles for recycling, and as you can see we get through quite a few. Batteries, so there's recycling opportunities for the alkaline batteries used within the facility, and we give these to the Rotary Group, who sell to another non-for-profit organisation for fundraising. Everything comes wrapped in plastic these days, including our clean linen. So each piece of linen comes wrapped in a plastic bag. So when those are removed, we use those bags to line our bins. Rehab theatres, ED and ICU, currently collecting lids for kids. I'm not sure if this is an initiative you've heard about, but they recycle the bottle lids and turn them into prostheses for children. So we've joined in on that opportunity. We've recently partnered with All Mold Plastics, a local medical circular research company, as part of our recycling project. So they've been collecting things that you can see here, just like our kidney dishes and pill packs, since the beginning of November. And the hope is that they will turn these products into something similar to what Forbes showed with the bollards or the seating benches. There's a wonderful recycling station outside of our theatres. As you can see, our theatres are very motivated in their move to recycle, where again, I just want to stress that making it as easy as possible for staff to not have to think too much about how they responsibly dispose of their kit. With COVID-19, the pandemic this year, we found the KimGuard was useful as the third layer for handmade masks. So we have a small group of hospital volunteers who are mainly elderly people who are making reusable masks to sell to the community, and they're using the KimGuard as a way of recycling material and making something useful for our consumers. Plenty of improvements we can make, but in the interest of 7 minutes, I've just listed a few. So the KimGuard we used to be baled and recycled, capturing around 90 kilos every 2 weeks and sold to China, but we've recently ceased. So we're looking for an alternative to recycle this product. And also the commingled recycling bins on every ward. So currently within the commingled recycling collection, there's a lot of soft plastics such as milk bottles and other plastic containers that aren't accepted by the bottle recycling services. So we're, Spotless are currently in conversations with Downer to look at ways that we can more responsibly dispose of these products. And also the Baxter fluid bags. And therein ends my presentation. So we have embraced plenty of opportunities in Orange, but we're always open to suggestions.
Thank you so much, Lacey. If you stop sharing your screen for a second, that's an extraordinary audit of all of the, in fact, there's a comment in the chat that talks about how important it would be for someone to do a walk through a health service and to be literally documenting all the different things. I hadn't even thought of things like batteries, to be honest, or in fact, things as simple as plastic bottles and milk bottles, because of course, in terms of food service. So thank you very much for showcasing what is happening in the Orange Health Service. And it's particularly exciting to have Paul, who is one of our speakers shortly from Baxter International, to talk about the partnership from the industry perspective. I'm now going to try and do something that I'm not super confident will work, but so bear with me. I'm just going to try and share a video about another example that Lacey wasn't mentioned, but I know we have people here from Parks Health Service, and I would like to show this video. Just bear with me, everybody. If I can, I may not be able to do it, but I'm hoping I can. Can you see this? Yep.
Yep.
Okay, I'm going to hit play.
Can't hear well, Anna.
I understand no one can hear that. Is that correct? Sorry that that has happened. I can make sure that that video was circulated. It's a story, you would have seen the visual, I hope, a fantastic story of colleagues at Parks Health Service who have engaged in a really exciting project of reobtaining single-use metals, which is another one of those extraordinary things that, of course, in the age of disposable and infection control management, a packet comes of several metal items. You open the packet, that item is used once, it then goes in the bin. So the idea is to reprocess that, to set up a new process within the health service to collect up that single-use metal and to send it on to a scrap metal company that then can make use of that metal so that it doesn't end up landfill and actually comes back into our world in a different form. I'm sorry that that you weren't able to hear that video. I've got an instruction here from our trusty IT colleague. If I can play it again at the end, I will. But now perhaps Paul, I could ask you to speak. Paul is the Marketing and Sustainability Manager for Baxter International. And Paul's going to tell us a little bit about how industry has engaged with the health service to make some of these things happen.
Thanks, Anna. Can you see that? Can you see the slides? Yeah. Okay, thanks so much, Anna. Yeah, thanks for the opportunity. I'd just like to share with you a couple of insights into how Baxter run their product stewardship programs and some of the sustainability initiatives that we have, and maybe add a little bit more colour to what Forbes and Lacey have already shared, and maybe share a couple of new things as well. I'll just navigate my way through this presentation. Hopefully this will move. So I think the first thing to probably take note of is that Baxter Healthcare do have a headquarters and manufacturing facility located in New South Wales. And this actually forms a lot of the foundation of our key programs, and not all of our programs, but of our key programs. So the facility in New South Wales predominantly manufactures IV fluids, which are made from the PVC material, IV fluids, but also renal fluids as well. And there is a small proportion of those products made from polypropylene. And this is just to share with you how we have looked at product stewardship in relation to those. But just to look back at the manufacturing facility and headquarters itself, Baxter employs around 1,000 people across Australia and New Zealand. And at the manufacturing plant, there's about 200 people making those 49 million products. At the site itself, we're quite proud of some of the sustainability initiatives that we have, looking at landfill diversion, moving to 87% last year and hopefully getting a lot closer to 100% by the end of this year. That's done through plastic segregation and recycling and on-site composting and a number of initiatives that we're starting to see around many of the hospitals as well. We've also got an energy program. We've got about 80% cleaner energy going into the plant with our solar panels, and we do have a tri-generation system that is powered not by coal but by natural gas. Still a fossil fuel, deemed to be cleaner, but by using these initiatives, we're putting a lot less pressure on the grid and moving the equivalent of 2,200 cars a year, just to sort of share with you how we're energizing the plant. But when it comes to the products themselves, we're running those production lines and very much applying the concepts of reduce and reuse. So those PVC bags are actually made up of 30% of materials reclaimed during that manufacturing process. The cartons themselves are made up of 35% recycled products. So just to show that even within our manufacturing processes, we have built in some sustainable mindset. We look at the materials that we are producing in the plant, and we've scrutinized their life cycle, how we've made them, where they end up. And the good news is the majority of what comes out of that plant in Toongabbie does have, there is an opportunity to recycle and reuse those. And I'll highlight specifically the PVC program that's been mentioned a couple of times already, but we do produce other plastic like the HDPE, which can be recycled. And the cardboard, obviously established recycling, and also the polypropylene as well. So just to maybe understand, Baxter does have a manufacturing facility and headquarters in New South Wales. We also have facilities, warehouses, compounding centres and commercial offices around many of the states. The reason why this is just useful to get a sense for how Baxter impacts each state, but having those warehouses allows us to manage some reverse logistics for some of the programs that we support around the country. So we know that single-use materials contributing to massive landfill challenges, and what we've tried to look at Baxter is a number of initiatives to try and reduce that impact. And I'll just share with you some of those now. So we talk about PVC recycling, and that's kind of the flagship program that we have, and I will go into a little bit more detail about how that actually works. And we also have a home patient recycling program for our dialysis patients who also use PVC bags, the HDPE bags and cardboard. And with our reverse logistics, we're able to reduce that waste burden from the home, the patient's home, and filter that material into recycled streams or recycling streams, which the materials not necessarily end up in. So that impacts about over 900 patients involved in those programs at the moment. The gas bottles, the aluminium gas bottles, can also be collected at hospitals, and they're used to make other products such as bike frames. And within the compounding space, we're starting to look at ways. So traditionally, we're compounding cytotoxic agents, which can't go through any other stream other than cytotoxic waste. But we're starting to look at the supply chain and how we can maybe make an impact there. So the use of reusable tubs and for our metro customers. We're starting to look at reusable insulation as well for our cold chain products. So these wool cool liners, something that are being introduced, make sure that the product remains in the appropriate cold chain, but the wool cool can be reused again, or it is actually compostable. But just to elaborate a little bit on the PVC recycling program, which we do run in conjunction with the Final Council of Australia, we are running that in over 250 hospitals now across Australia. And effectively how it works is at the bedside, these PVC products, including the Baxter infusion bags, but also the oxygen masking and the oxygen tubing. Once the hard plastics and metal have been removed, the clinician can place these into the bin. The bins are then collected by our waste partners in the States, and using Baxter's logistics, we transport them down to Victoria, where they're sorted, and then they're processed by Welvic, who are a PVC manufacturer. They basically chop up the bags, and through the extrusion process, they create the PVC resin, and that resin then gets sold on to other organizations who produce other products. So the hoses get produced from the recycled PVC, but more recently, these gumboots are actually made of 100% recycled resin, and these gumboots are actually made in the Mornington Peninsula by a company Bata down there, and these actually can be sourced from Bunnings or Big W. The beauty of these gumboots, again, so sometimes we get asked the question, once these are recycled, well, where does that PVC end up? Actually, these gumboots can be recycled again and again, and Bata actually have a program where they can continue to recycle this. So again, it is a local solution, and it is providing a home for material that would always otherwise end up in landfill. The bags themselves, we identify that they're PVC. They have the little 3 embossed in the corner, and also the packaging as well refers to the bags, the PVC bags, but also to our over pouches, which are also recyclable. You can see that in the packaging. So just to provide that guidance for how we know. So there are a number of benefits. Obviously, the end users benefit. They're finding a new way to dispose of the waste, which then ultimately ends up creating some jobs around the country in terms of collection services, in terms of recycling. And like I said, the main benefit here is that the products are produced in Australia, the material is retrieved in Australia, it's recycled in Australia to make other Australian products. I'm very proud of the messaging that's associated with the PVC recycling program. Just to give you a snapshot of the numbers, 2019, we did recycle across Australia and New Zealand 200 tonnes of the PVC, so that's 200 tonnes diverted from landfill. And similarly with the aluminium, number not as grand, but in excess of 1 metric tonne diverted from landfill, and recycled instead. Those numbers, again, have been impacted by COVID 2020, but we will still see some healthy numbers coming through, which we'll hope to report early next year. And thank you for your time.
Thank you very much, Paul. And to be honest, before we even started on this journey of putting this together, I actually had no idea that organisations like Baxter were doing such comprehensive work and thinking through the supply chain of how to actually make this something that is achievable within the health service, where it doesn't load extra significant administrative burden onto clinical staff who are also just trying to keep people alive and keep people healthy. Thank you very much. It's an extraordinary amount of volume that is being removed from the waste pile, which is exciting to hear. And it's always, you know, it's fantastic to hear that Baxter is doing this, and I'm sure many other companies are too. So anyone in any health services out there who know that Baxter is supplying their IV bags, Paul's your man to find out how to join the program and participate in the retrieval. I was told by, obviously I'm a fan of our local health district, I was told by one of the cleaners at the local health district that Orange Health Service is one of the very proud highest return suppliers of IV from rural areas to Baxter. So it's really exciting to see that this is possible in both an urban and a rural setting. Thanks so much. And there's a message from Annie Zhang. Great presentation, Paul. Now, speaking of the volume of waste, we have the man now to speak next who knows everything that there is to know, I think, about waste and waste management, particularly in regional areas. I'm going to ask Anthony Cullen-Ward to speak next, and Anthony's the coordinator of NetWaste. NetWaste is a network of 26 local government area waste management units of local councils in regional New South Wales. And as we see the change that's happened with the China sword policy cutting off the path of Australia sending its waste overseas, we see that the can is being kicked from the urban centres back into regional Australia in terms of how to manage waste locally. And so I'm going to invite Anthony to now speak about his perspective. And I don't think we often ask the people who are at the tail end of this enough about what they see and what opportunities they see for potential change to green our health system. Over to you, Anthony.
Great, thanks, Anna. Can everyone hear me okay? Yep, cool. Right, okay, let's go back one. Just a quick history of NetWaste. So, Anna said we cover 26 councils. It's a third of New South Wales, so we're very, very big on collaborative measures around the region and trying to, I guess, coordinate as much recycling and, I guess, effective waste management as possible. I haven't had a lot to do with hospital waste as such, but I did manage a landfill in a previous life, so I am aware of the types of products that get used in the system. And yeah, NetWaste, we look to, I guess, maintain sustainable waste management models from region to region. And I guess it's challenges within that region because there's such different areas as we move west. And we have different, I guess, strategies to address those issues that those particular councils have, and I guess their medical practices as well. So yeah, we'll talk a bit about that. I guess starting off, looking at the EPA waste hierarchy, how you would kind of, I guess, address raw waste and recycling issues in regards to medical and health services. The first three tiers of that hierarchy, avoid and reduce, reuse and recycle, I think would probably be the best places to start, especially in the avoid and reduce waste. I think I'm a big fan of auditing. I think auditing is a really good start, no matter what product you're trying to recycle. I think auditing is an excellent start, and actually see how much material is being used through your systems and what types of materials present themselves, and basically looking at those materials as a resource rather than just a waste type. So just a quick bit of research, I found out that, yeah, 260,000 tonnes of waste per annum through Australian hospitals. I was pretty blown away by that amount, actually. That's, put that in perspective, that's enough waste to fill the Orange waste facility, I think 5 years worth, I think I calculated that. So it's an amazing amount of waste that gets produced every year. And just also looking at the World Health Organization fact sheet, yeah, a lack of awareness alongside the absence of waste management and disposal systems and insufficient financial and human resources are some of the most common problems. And I think probably all agree on that. It's just a common thread throughout many, I guess, health practices. It's just, I guess, having that awareness and having the funds and the manpower to actually undertake those recycling practices is a really, really tricky thing. And also around 85% is this general non-hazardous waste. So we kind of refer to that as household waste. So there's definitely a lot of opportunities there for the taking as far as health waste and health recycling is concerned. And having worked on a landfill, that is the stark reality of where this material ends up. Once you've put it in the bin, that's exactly where it heads. It gets compacted and then it gets covered with fill material, and you'll never see it again. So unfortunately, landfilling is the most common practice in Australia. We've got all this wonderful land that we have, and it is by far the cheapest and best option at the moment. So yeah, that's the stark reality of it all. I guess to undertake any effective recycling, you need a plan, and I just thought I'd jot a few things down as how I guess NetWaste or myself would look at a process, and kind of a 13-step process. Number one, be kind of auditing that waste stream and the waste generators on site. So not only are you have you got kind of streams going out, you've got kind of streams coming in and generations on site, and it'd be really good to audit all those generations and streams that are under the one roof. So you identify those used products or items for potential reduction and reuse, and that's, I guess, as a step two, that's probably the most cheapest option you have is a potential reduction and reuse of materials. You identify the products that cannot be reused or reused or reduced, it should be, but recycled. Does the product have any value, be it actual, perceived, or otherwise? So you may find a particular product, but it may not have any actual value, and it might be so difficult to recycle. It's not worth it. I guess you've got to work out what products are costing you the most money to recycle. And of course, you need a full stakeholder buy-in, education, training, and a budget to normally undertake these recycling systems. And by the looks of it, I was blown away by some of the systems that have been presented today. There's some excellent systems out there. So yeah, I'm overjoyed with those systems. I didn't realise a lot of that existed. So that's terrific. Recycling and waste management as a whole can be quite dangerous sometimes. So it's always a good idea to take into account work health and safety and be able to undertake these systems safely, because it's at the back end, it's people doing the work and the separation. So that's really important. Your ability to segregate the products at the source. You also need a capturing system, which involves more segregation. Collection and logistics, transfer system, be on the curbside, a purpose bin, which we've seen, or a pickup. You also need processing and transport systems. Having them, the closer the better. And I know one of the challenges we face out here west of the Blue Mountains is having the closeness of those processes and transport systems, because that actually puts the price way up, and it makes it very difficult to recycle some of those unique products which would otherwise they would be probably recycled in the Sydney Basin because it's closer, whereas up here it may actually just get put to landfill. You also need an identified market for those recycled products, and I know the state government are really working hard to have a circular economy, and I'll be talking about that a bit later. And also closing the loop on the sale of those products. back into the market. We saw with that PVC recycling, that's a perfect example. That's excellent. And like anything, your long-term plans of management and funding, that's probably the most important part of things. So to add to the longevity of these recycling systems and get them set up properly in the first place. Medical waste, how I've kind of looked at it, it's probably traditionally disposed rather than recycled. Waste is not seen or visible to the public. So I know when I was working at landfill, we rarely see medical waste come in because it's a fairly hidden waste stream. So it actually gets taken care of in a variety of ways, and a lot of the I guess the household waste or the common waste comes in plastic bags. You don't really get to see a lot of it. But I guess the only public concern is that it needs to be managed effectively. There's some waste items that are dangerous, such as sharps, and that does, I guess, create a bit of attention and attracts more attention than you'd want sometimes. Segregation, which I believe is happening, and all those systems that we saw before was just fantastic. There seems to be a lot of opportunities too to recycle more medical waste on site. And when you've got a holistic approach, so looking at the whole gamut of services that you provide, and I guess the items that are used in those treatments, it just makes it a far better opportunity to look at the whole box and dice, so to speak. Facilities management and treating staff centric. So you've got a whole range of stakeholders internally that you've got to look at as well. So you have the site staff for cleaning, so your procurement, your contracts. You have stakeholder engagement, and look, like any hospital, it would have a lot of different platforms and departments. So yeah, you'd have to go through, I guess, all of those departments to make sure that that chain's complete and the directives report up and down that management chain. And it'd be great to establish a waste management committee or on-site group at some of these health services. Cool. Just a bit on closed loop. I mean, that's a closed loop on just a bottle being made, just through steps 1 till 9, and that's basically what happens to the bottles that are, I guess, offered out. The water bottles at hospitals, they all go down to Visi, down in Smithfield, and I've actually had the pleasure of going to that factory and seeing this done. So we actually have bottle recycling and production in Australia, which is wonderful. So you'll look at those steps 1, 2, 3, 4 through to 9, and whenever you go to buy your next bottle, there's a good chance that it's actually made out of recycled materials. So I'm hoping with the closed loop and circular economy that New South Wales State Government, they're going to release a 20-year waste strategy. We'll be looking at some local manufacturing, which is really exciting. I guess moving on, you probably want to do a SWOT analysis. That's probably one way of, I guess, auditing, looking at what products you've got under the one roof. The strengths, I guess, there are some better technologies that are available for recycling. And a lot of those we've seen today. There's some excellent I guess, opportunities out there. So,
Anthony, we've just got 1 minute left for you.
Yep, sure, okay. I guess the weaknesses is a large stakeholder engagement with any of these groups. You're primarily, like, you're delivering care, I guess, so yeah, the environment kind of takes a back step, so I guess trying to bring it to the forefront. The opportunities, the resource recovery can be built upon into existing contracts and existing markets. There's lots of medical streams that have always been there. I guess it's identifying those streams and looking at that China waste ban to inspire local manufacturing as well. The threats, I mean, it's always resource heavy. Long-term plans of management are needed. So yeah, and you've always got, I guess, the contamination of the red bin. So making sure those materials don't go in the red bin and they're recognised early on in the piece. Rethinking waste as a resource, just, I guess, looking at more opportunities, moving away from single-use plastics, which has been covered before. And I guess making recycling a viable option rather than landfilling. And you're trying to move to that cost-neutral environment as well, and taking on a holistic process as well. Auditing and creating those data sets. There is grant funding. I'll cover this really quickly. I found some grant funding. So Circulate, New South Wales Industrial Ecology Program. There are grants available right now. $20,000 up to $150,000. The website and the contacts are there, and it's actually open till the 12th of February. So they are grants that could be used by the health service, which I think is great. I kind of just stumbled across these, so I think it'd be really good and there's an opportunity there for the health service if they want to use that. So yeah, thank you very much.
Thank you very much, Anthony. You can leave that slide up if you like. I always love a speaker who finishes on a positive, and the fact that there is in fact funding available and open until February and not due in 3 days' time is always an exciting piece of news. And for all of our participants today listening, if this sounds like something that you might be interested in applying for, I believe it's a New South Wales funding.
Yeah, New South Wales EPA.
Through the New South Wales Environmental Protection Authority. Thank you very much, Anthony, for putting that back up. It was actually in a conversation with Anthony that I realised that part of what we're also trying to do with this panel and our subsequent events is to bring the waste management and the health service together. And one of the anecdotes that Anthony once shared with me was when a big truck rolls in that's picked up waste from the health service, there doesn't necessarily, people working at the landfill might not know whether there are body parts or sharps or God knows what in it. And so the idea that we can be streamlining and organising the health waste in such a way that there's greater confidence across a range of sectors of what is actually happening. And I think that begins with getting out of silos and communicating with each other and working with industry partners who work across those supply chains such as Baxter. Now, it is time to open the floor to questions, and we have had some questions earlier on. And so I'm just going to, panelists, if I can throw to you. We had a comment earlier on from Rachel Codd, who was talking about the opportunity to recapture excreted therapeutic agents. So I understand by that medications that people are then excreting in the system, pardon my lack of chemical engineering knowledge, whether that can be recaptured so that those medicines are then not put into the waterways. Is there a panelist who has a particular perspective on that who would like to speak?
I mean, Anna, that's a really important question, and it's one that a lot of doctors and nurses, I think, are quite worried about, understandably, because although you may be able to reduce, say, a carbon footprint of something, I think worrying about the aquatic and terrestrial and contamination thereafter is also very important from an environmental perspective. I think it's one that I think, so certainly we can place pharmaceutical waste into pharmaceutical bins and things like that, but I think there's an ongoing lingering concern about where that ends up, or the fact that a lot of it doesn't end up in there. It is just thrown into general waste, etc. So I think it's actually one that needs a lot of teasing apart and a lot of hard work to do, as I was trying to perhaps show in my presentation. All these things, if you want to do them well, actually take a lot of time and effort. And so maybe engaging the EPA, I'm not sure whether which state we're referring to, but probably New South Wales, would be a good place to start, and engaging a bit of a literature search of the topic. But there certainly is increasing interest in that. I can assist anyway.
Thank you, Forbes. We do have another question from Stacey Conash. I hope I've pronounced your your name correctly, Stacey, who asks, what are the barriers to organise those disposable metal instruments to be collected, cleaned and resold as the instrument instead of scrap metal? Is there interest in hospitals to support that type of a business model, or is it that type of purchase decision outside hospitals' realm? And I might throw to Lacey, if that's okay.
Yeah, so I think it is a little bit outside of our realm in that we would have to partner with another provider to achieve any results in that arena. I mean, but what we've seen so far from the various presentations, that if there's an appetite for it, then I'm sure that we could find the right provider to partner with to help us achieve that. Yeah.
Thanks, Lacey. In the same way, yeah, we're doing something similar at Western Health, and I certainly shout out very much to the Parks team as well. That you have to team up with a provider, but it can actually save money because the metal would otherwise go into infectious waste bins, which are very expensive, the most expensive way of getting. So the bin itself is more expensive in those Sharps types of bins, is more expensive 4 times as much as the general infectious waste versus the general waste. So it's it can actually save money as well. So and it's stainless steel, most of this stuff.
Yeah, so my advice moving forward for the Parks team is get in touch with your business manager there locally. They'll manage all your contracts, including contracts for waste, and see if they can help you source a provider, someone to partner with.
Thank you. We have another comment, in fact, in the question and answer from Vanu Nazarian, which is, if there is hospital equipment, machinery, beds, etc., that are no longer in use, Rotary Australia World Community Services will take on those goods from hospitals and repurpose to developing countries. So that's also a shout out there. That was Rotary Australia World Community Services, who will take on those goods from hospitals and repurpose them to developing countries. I haven't got any more questions in the chat, but if you would like to ask our panelists any more questions, we still have a couple more minutes.
And I would just say a shout out to the Medical Pantry. My good friend Martin Noonan. I have no vested interest. We make no money out of it. It's all very much along the same lines of Rotary International. They're really good at. Martin's an anaesthetic doctor as well here in Western Health. It's great to know that, so basically they've developed a website you can look at, and you can say, oh, okay, here's some things I might be interested in for if I'm going overseas to, the Pacific, for example, to do some procedures, or these people need it. These are some things we do. And it's a good way of, because unfortunately a lot of less developed nations end up with necessarily, one could say, junk that people may actually not find much use of. It's delivered to them and then they don't know what to do with it. I remember seeing CT scanners in Vanuatu like that. So this is a great way to do it in a focused way. So good on Rotary, well done.
Thank you. They've got 2 more questions, and then we will have reached the our time limit, I'm afraid. And the next 2 questions is, what is the role of local government in greening the healthcare system? And the second question is, rural remote facilities in Western New South Wales Local Health District have very limited access to recycling services. Is this something NetWaste will investigate and into helping council to provide this service? So we might go first to the role of local government in greening the healthcare system, if we may. And I don't think, Anthony, would you feel comfortable responding on that?
Yeah, that's fine. Well, as far as rural remote facilities, this year we're actually working on a waste aggregation profile report. So that's recognising, I guess, the amount of waste and or potential resources at each council area. And I know exactly what we're talking about. It is so difficult to get that recycling up and running when you're so far away from a market. And I think what I didn't cover, I ran out of time, is the release of the 20-year waste strategy from the New South Wales State Government. So that'll be released in early 2022. And that will have a very heavy circular economy approach to it. So we're actually starting that process now on getting our strategies up to date. And one of those actual documents is the waste aggregation profile, which is looking at the whole of the 26 councils in the NetWaste region and actually doing a study into how much material, be it resources and or logistical links, are available throughout those 26 councils. And I think a large part of the problem is logistics, and it's cost so much to actually get these materials moved from Western New South Wales down to the Sydney Basin where these markets are located. And it's always been a big issue for NetWaste, is trying to bridge the gap of getting those logistics links set up and somehow being rebated. And look, it has been done with systems such as return and earn. So return and earn is the beverage container recycling system, and they've had those set up in Broken Hill, so it's not impossible. So yeah, we'll be looking at that for sure.
Thanks, Sam.
We've already started, which is great. So.
Very final last questions, and I appreciate people will need to drop off to the next meeting. The last two questions was, could the panel comment on the biggest challenges for taking next steps? And the second question was, for health consumer reps who are interested to discuss these further with the health services they partner with, what is a good start? How do we ask, prod on kickstarting an audit? Would it be the quality safety team? So first question, biggest challenges. Second question, who in the health service do people interested in partnering with you need to speak to?
So I think, you know, one of the logical first steps forward is looking for quick wins. So as Anthony said, you know, audits are really important to understand what you have on site and where there's a capability to get started immediately. And then it's a little bit more of an intensive process to look at things that don't have an immediate solution. So yes, it would be a quality safety team, but it is also a discussion, as I mentioned before, because it's about managing contracts to have with your business managers or your corporate managers.
Thank you, Lacey. And I might just now call to each of the panelists to give in 3 words or less your biggest challenge on taking next steps. And I might start with you, Paul. Biggest challenge, first thing that comes off the top of your head.
Yeah, I think the biggest challenge is having an engaged and committed local team. I think that's where you get the most success. Yep.
Thank you. Forbes, your 3 words of the biggest challenge for taking next steps.
I think it's single use, just those 2 words. That's the biggest challenge that we're all facing, and that's why we've got a tsunami of waste, because we have a linear approach to medicine, and it's take, waste approach. There are ways around it, but it's very hard and it takes a long, sustained process. Thanks.
Thank you, Forbes. Anthony, 3 words, biggest challenge.
Circular economy and logistics, that's NetWaste's, I guess, biggest challenge is just having those markets, I guess, relocated further west and having the, I guess, the logistics to handle those products and get them to market, and therefore closing the loop. So circular economy and logistics.
Lacey, final words?
I think it's cultural. That one of the challenges is building a culture in your health facility where they see, where there's real buy-in and they can see the benefits.
Thank you. We've reached 3 o'clock, and I'm excited to say that we're now having a offline discussion with the local Orange Health Service about what we can be doing in Western New South Wales local health district. And thank you everyone for joining us. We hope there's been some food for thought wherever you are beaming in from today, and what might be possible within your health district, within your place of work, where you receive your healthcare, where you throw away your waste. Thank you for joining us, and a special thank you to our panelists, Lacey, Paul, Forbes and Anthony, and our sponsors, Orange City Council and Western New South Wales Local Health District. Thank you very much, everyone, and thank you so much for being with us today.